What is EMPAVELI? Pegcetacoplan.
EMPAVELI is a prescription medicine used to treat adults with a disease called paroxysmal nocturnal hemoglobinuria, PNH. What is the most important information I should know about EMPAVELI?
EMPAVELI is a medicine that can affect your immune system and can lower the ability of your immune system to fight infections. EMPAVELI may increase your chance of getting serious and life-threatening meningococcal infections that may quickly become life-threatening and cause death if not recognized and treated early. EMPAVELI may also increase the risk of getting serious infections caused by certain bacteria such as Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B. Serious infections may quickly become life-threatening and cause death if not recognized and treated early. You must be vaccinated against these bacteria at least 2 weeks before your first dose of EMPAVELI if you have not already had these vaccines.
Hi, I'm Emma. I was born in Canada but raised in the Midwest and currently live in Michigan. I live a busy life filled with work, friends, and family, and my hobbies include binge watching my favorite TV shows, reading, drawing, painting, and graphic design. In 2016, I was diagnosed with aplastic anemia, and while on treatment for the aplastic anemia, we were monitoring my PNH clone. In 2019, my doctor confirmed that I no longer had aplastic anemia and was diagnosed with PNH. When I was first diagnosed with PNH, I did not know much about it. The diagnosis initially was definitely shocking and frightening. All I knew was that it was a chronic, lifelong, rare blood disorder that likely had no cure in sight. I had been enrolled in college at the time, and I did end up withdrawing from my semester because of how sick I was, and that was also really frustrating and disappointing for me. I felt like I was in limbo, waiting for medications to work and waiting for new medications to try. While I had some improvement on my past treatment, I was still needing regular blood transfusions due to low hemoglobin. I had originally been planning to enroll in a clinical trial that was not for EMPAVELI. However, I found out that I did not meet the eligibility criteria, and that is when I went to my doctor to seek out other treatment options. I talked to my doctor to see if EMPAVELI was the right fit for me after reading the study results in a published journal article. I was really curious about what EMPAVELI's study showed on improvements of hemoglobin levels, and wanted to explore this as an option. My doctor did go over the serious side effects and risks of infections with me and determined which vaccinations I would need prior to starting treatment, which I did receive. And 2 weeks later, I started EMPAVELI. It was definitely challenging at first to start a new medication, and overcoming my uncomfortableness with needles was also challenging for me. I just made up my mind that I was going to focus, and with the support from my family and my Apellis Care educator, Ace, I was able to learn to self-infuse. I also watched the video on EMPAVELI's website, how to self-infuse, and that was also really helpful. Prior to starting EMPAVELI, my hemoglobin levels were below normal. After 2 weeks of being on EMPAVELI, I saw my hemoglobin levels rise, and I am now consistently around 13. This is exactly the kind of response that my doctor and I wanted to see with my hemoglobin levels and being on EMPAVELI. I have not needed to take time to schedule transfusions because I have not yet needed a transfusion since starting EMPAVELI, and I also don't need to schedule time to go into the infusion center anymore because EMPAVELI is a self-infusion treatment. I did experience an adverse reaction on my thighs, and I contacted my doctor to discuss that with them. I self-infuse 2 times a week, and after learning how to self-infuse and what time of day works best for me, I was able to work it into my weekly routine. I like to take that time when self-infusing for myself and either catch up on an episode of my favorite show or read during infusion. I really do feel a sense of accomplishment after completing every single treatment, and it's really instilled in me self-confidence in completing my EMPAVELI treatments. I have discussed it with my doctor, and I am now able to travel with EMPAVELI and not disrupt my infusion schedule at all. As long as I keep it at the right temperature, I can take my medication and supplies wherever I need to. My life is very busy with my family and friends, and so I love that EMPAVELI works with my lifestyle. Advice I would give to those living with PNH or seeking treatment would be to always ask questions, always express your concerns and reservations regarding your treatment and your condition. Living with chronic illness is already so challenging. It's really important to be aware of your symptoms and what might affect your condition. The other thing I would say is don't be afraid to ask for help, and always do what you need to do to take care of yourself. Prioritizing your treatment and your health is so important, both mental and physical health. And if any of this struck a chord with you, talk to your doctor to see if EMPAVELI is right for you.
EMPAVELI, pegcetacoplan, is a prescription medicine used to treat adults with a disease called paroxysmal nocturnal hemoglobinuria, PNH. EMPAVELI can lower the ability of your immune system to fight infections. It may increase your chance of getting serious and life-threatening meningococcal infections. And serious infections caused by certain bacteria, such as Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B. These infections may quickly become life-threatening and cause death if not recognized and treated early.
You must be vaccinated against these bacteria at least 2 weeks before your first dose of EMPAVELI if you have not already had these vaccines. If your healthcare provider decides that urgent treatment with EMPAVELI is needed, you should receive the required vaccinations as soon as possible. And you should also receive 2 weeks of antibiotics with your vaccinations. If you have been vaccinated against these bacteria in the past, your healthcare provider will decide if you need additional vaccinations before starting EMPAVELI.
Vaccines reduce the risk of serious infections, but do not prevent all serious infections. Call your healthcare provider or get emergency medical care right away if you get any of these signs and symptoms of a serious infection. Fever with or without shivers or the chills, fever and a rash, shortness of breath, extreme pain or discomfort, headache with nausea or vomiting, high heart rate, headache and a fever, headache with a stiff neck or stiff back, confusion, muscle aches with flu-like symptoms, clammy skin, eyes sensitive to light. Your healthcare provider will give you a patient safety card about the risk of serious infections. Carry it with you at all times during treatment and for 2 months after your last EMPAVELI dose. It is important to show this card to any healthcare provider to help them diagnose and treat you quickly. EMPAVELI is only available through a program called the EMPAVELI Risk Evaluation and Mitigation Strategy, REMS. Before you can take EMPAVELI, your healthcare provider must counsel you about the risk of serious infections caused by certain bacteria, give you information about the symptoms of serious infections, give you a patient safety card about your risk of serious infections, and make sure that you are vaccinated. Do not take EMPAVELI if you are allergic to pegcetacoplan or any of the ingredients in EMPAVELI, have not been vaccinated against Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B, unless your healthcare provider decides that urgent treatment with EMPAVELI is needed. Have a serious infection caused by the previously mentioned bacteria. Before starting EMPAVELI, tell your healthcare provider if you have an infection or fever, are pregnant or plan to become pregnant. EMPAVELI may harm your unborn baby. Females who are able to become pregnant should have a pregnancy test before starting treatment and use an effective method of birth control during treatment with EMPAVELI and for 40 days after the last dose. Are breastfeeding or plan to breastfeed. You should not breastfeed during treatment with EMPAVELI and for 40 days after the last dose. Tell your healthcare provider about all the vaccines you receive and medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements, which could affect your treatment. If you stop taking EMPAVELI, your healthcare provider will need to monitor you closely for at least 8 weeks after stopping EMPAVELI.
Stopping treatment with EMPAVELI may cause a breakdown of red blood cells due to PNH. Allergic reactions can happen during your EMPAVELI infusion. Stop your EMPAVELI infusion and tell your healthcare provider or get emergency medical care right away if you get any of these symptoms during your EMPAVELI infusion. Chest pain, trouble breathing or shortness of breath, swelling of your face, tongue, or throat, feeling faint or pass out.
The most common side effects of EMPAVELI are injection site reactions, infections, diarrhea, pain in the stomach, abdomen, respiratory tract infection, pain in the arms, hands, legs, or feet, low potassium in blood, tiredness, viral infection, cough, joint pain, dizziness, headache, and rash.
These are not all of the possible side effects of EMPAVELI. Be sure to tell your healthcare provider about any side effect that bothers you or that does not go away. For more information, ask your healthcare provider. Talk to your doctor for information on EMPAVELI. Please see important safety information, including boxed warning regarding risk of serious infections, and the full prescribing information and medication guide at empaveli.com.